Hey everyone, it's time to start our periodontics lecture, so on we go. So here are some objectives that you can read on your own, so you can stop the video and read through the objectives on this screen and this screen. So the introduction begins as the dental assistant in the periodontal office must have a thorough understanding of periodontal diseases and the types of periodontal instruments and procedures that go along with working with periodontal disease. In a practice that does periodontal treatment, the dental assistant will assist with perio charting and perio surgeries and also provide home care instructions to the patient. If you are working with patients who have surgeries, you may be able to place periodontal packing over the wound if you are an expanded function dental assistant who is certified to do that task. The periodontal practice have patients which are referred by the general dentist or hygienist for treatment of a periodontal condition. After the perio treatment, the patient typically returns to their general dentist for routine dental care. Frequently, though, periodontal patients will alternate with the periodontal maintenance as a cleaning with both their periodontist and the general dentist office. But please remember that periodontal procedures can be done specifically and solely by a general dentist unless the doctor doesn't feel comfortable treating the case or the case is too advanced for what their scope of the practice is. The staff in the two offices, so the general practice and the perio office, must coordinate these perio maintenance therapies between the two practices to provide comprehensive care for the patient. So typically when the patient would go to the periodontal office, they would simply have their x-rays and their cleanings done by the periodontist and their staff. When they're referred back to their general dentist, that doctor will do a caries check and then do any restorative work that may be necessary. So the perio examination includes obviously medical and dental histories and radiographic evaluations. So that phrase is highlighted because the radiographic evaluations are going to include periapicals, and a lot of times if the perio has advanced, it's going to include vertical bite wings so that they can see just how far the disease has progressed, which you can't see well on horizontal bite wings. Then they will do an examination of the hard tissue, the teeth, and then examine the other oral tissues and supporting structures. And then a periodontal chart will be created for the patient as well. Periodontal charting is going to include pocket depths, plication involvement. So if the multi-rooted teeth have loss of hard tissue support, that will be noted. It will include if the teeth can move, so that's called tooth mobility, and that is recorded in classifications. It will look at any exudate or pus that is emitted from the sulcus around the teeth, and also will record gingival recession. So here's what a standard perio chart looks like that is generated on the computer. The chart knows, just like our Dentrix chart, if the teeth have crowns on them. So the upper left quadrant has some gold crowns, and there it looks like there's a gold crown on the lower left as well. A couple implants are visible here in the mandibular anterior. There's a bridge on the maxillary anterior, and then these lines can show on the graphic chart where the loss of attachment is. It also includes these little triangles to say that there is a furcation involvement here, and it will chart recession. It will record bleeding points if there's pus involved, etc. So it's a really great chart to have on your patient. And here is how the periodontist or hygienist is looking to do the charting. You can see that the Dentrix chart is actually up in the background, and this person is either calling out the numbers, or they'll take 3 numbers or 6 numbers and they will plug them into the chart on their own if there is no one there to help record those into the computer. So when you're taking the medical and dental history for your patients with periodontal disease, we need to remember that systemic diseases such as acquired immunodeficiency syndrome, human immunodeficiency virus infection, and diabetes, so AIDS and HIV and diabetes, can decrease the resistance of the tissue to further infection. So obviously, when the person is immunocompromised, they cannot resist other types of infections that are happening. Dental histories are used to gather information about conditions that could indicate perio disease. For example, patients with perio often complain of bleeding gums, loose teeth. They can have bad breath and bad taste in their mouth as well. When we're doing the exam, we're looking at mobility. So it's normal for teeth to have a very slight amount of mobility or tooth movement because of the cushioning effect of the periodontal membranes. The excessive mobility, though, can be an important sign of periodontal disease. So we always are looking at this movement, and that is to allow our teeth to move if we bite on something too hard or hit a popcorn kernel or something like that, or we grind our teeth a little bit. It allows our teeth to not be caged in concrete, and they can move and protect themselves. But when they become too loose, then we are aware that there is an attachment loss of the bony structures. So mobility is checked. Typically, the doctor or the hygienist will use a mirror handle and the handle of the probe to look for the mobility. If they just use their fingers and try to do that, the fleshy parts of their fingers may mimic movement that they may feel but not actually see. So when they do that with 2 solid instruments, that allows that mobility to be better visualized by the operator. For oral tissues and supporting structures, the examination is also going to assess the amount of plaque and calculus that's present in the patient's mouth and where those buildups or accumulations are located. It will check changes in the gingival health and bleeding from one examination to the next, and it will assess the level of bone that is there by doing the periodontal probing. And this is done to detect the levels and the depths of the periodontal pockets that are present. When a doctor or a hygienist probes, the pocket results when the gingival sulcus becomes deeper than a normal reading, which is greater than 3 millimeters. So 1, 2, or 3 millimeters is considered within normal limits. Anything above a 3 is considered a periodontal pocket. These probes measure how much epithelial attachment has been lost to the periodontal disease, and the greater the depth of that pocket, the greater the loss of the epithelial attachment in bone, which also equals more serious periodontal disease progression. These pockets are very difficult and sometimes impossible for the patient to clean. So here is a look of 2 sides of a tooth. We have on the side of A, we have a healthy root, and we have enamel, we have dentin, we have the gingival tissues coming up right at the anatomical crown of the tooth, we have the cementum, etc. So we have a very healthy, very lovely structure here on the side of A. On the side of B, we have the calculus particles, we have the periodontal pocket now has receded from this anatomical crown all the way down to the side of the root, and we now have this pocket that we have for the patient to clean and try to maintain, so we have this much deeper area where the calculus and plaque can build up for the patient and cause inflammation to occur, which is not healthy. So we check this and record these depths with a periodontal probe. So the hygienist or the doctor will take the probe and insert it and slide it down the long axis of the tooth until the end of the probe hits a stopping point, which is the bottom of the pocket. So when we have early signs of periodontal disease, we notice changes in the gingival color, the size of the gingival tissues, the shape, and the texture. So remember, we want it to be stippled like an orange peel. We want it to be knife edged and sharp around each of the teeth. We want it to be appropriate size and normal healthy color for the patient and the pigment of their skin. When we have gingival inflammation present, that usually is going to be indicative that there's going to be bleeding happening. We can also see signs of pus coming out of the pocket upon probing, which is also, as you can imagine, an unhealthy situation. And then these things all together can develop deeper periodontal pockets for your patient. We're going to record the bleeding index. So this measures the severity of the gingival inflammation that can be measured by this bleeding index. So when the hygienist or the doctor takes those recordings, they're going to go in 6 different measurements around the tooth. So the distal buccal, mesial buccal, mesiolingual, straight lingual, and distal lingual, and you can call this the straight buccal as well. So those 3 probes, once the probe is inserted into the pocket and removed, if the point bleeds, we can indicate that on the bleeding index for the patient. We can also look at their radiographs. So these radiographs are a very valuable aid for evaluating periodontal disease. So this is a horizontal image, and this is why a lot of doctors and hygienists like to look at vertical bite wings to just really check and see how far that disease has progressed. We have some bone loss here. We have a really severe amount of bone loss in this pocket. We have a low calculus spicule here, and we have some defects in the bone here, and we have another area of bone loss. Basically, this would be a generalized bone loss, generalized perio patient. And this is an example of some vertical bite wings. So you can see how much more real estate you can see from these 2 by having the image receptor flipped on its axis. So you can see it's almost like a periapical image versus a bite wing, so that we can really see what that interdental bone looks like and the level that it presents. Periodontal instruments are required in periodontal therapy, which require the use of these specialized instruments to remove calculus, to smooth root surfaces, to also measure the pockets and perform surgeries. In general, the dentist or hygienist who uses these instruments takes responsibility for maintaining their sharpness, because you can imagine if they're removing debris from underneath the soft tissue, those instruments need to be quite sharp to do that without injuring the person. Probes are used to locate and measure the depth of the perio pockets. On some types of probes, the tip is color-coded to make the measurements easier to read. Probes can be tapered to fit into the gingival sulcus and have a blunt, rounded tip. There are 6 measurements taken and recorded for each tooth that the probe goes around. So here is a look at kind of a different style of periodontal probe with this little ball at the end to help keep it a little bit less traumatic, but it also needs to squeeze into the sulcus for healthy patients. So we have a 3 millimeter, 6 millimeter, and it jumps up to 9 and 12 millimeters usually for these types of probes. Explorers are used to locate supragingival and subgingival calculus deposits and provide a tactile information to the operator about the roughness or smoothness of the root surfaces. Longer and more curved than those used for caries detection are done with periodontal explorers. The working ends of these are thinner, finer, and easily manipulated around root surfaces. They also are long enough to be capable of reaching into the bases of those deep pockets and furcations. So here is a look at a pigtail explorer to be able to get into that sulcus and into the furcation area, as you see here.